Hi everyone. Today's episode we're going to speak about cataract. Cataract is a very common disease in ophthalmology, especially with old age. And it's the leading cause of vision loss. However, the good news, it's one of the most treatable with excellent outcome. Before I get into what is cataract and how we diagnose it and how we treat it, let me remind you first with how we see. And if you remember, this was the anatomy of the eye. If we have an eyeball, we take a cut section and we're looking from the side. This part in front here is the cornea. These two lines here are the iris. Behind the iris, this is the lens, which we're going to focus on it today. And obviously, this is the back of the eye, the retina, and this is all the vitreous cavity. How do we see? So for any object that we are able to see, whether it's a car, a pen, a tree, a light has to fall on this object, and this light needs to be transmitted inside the eye. It goes all the way through the cornea, anterior chamber, the pupil, and then the lens in order to fall back on the macula of the retina or the central part of the retina, where this light is transformed into electrical signals. And these electrical signals will pass through the optic nerve to the brain. And in the brain, it happens where we comprehend the picture, where these electrical signals become translated into an image, and we can know, oh, it's a car coming, or this is a tree, or this is an object. So for us, and for the disease that we are going to discuss particularly today, you have to remember that for the light to pass to the back of the eye, it has to go through several areas, like the cornea, like the pupil, like the lens. And all these parts has to be clear. It has to be transparent. They have to transmit the light. Giving you this reminder, now we can discuss what is cataract. Cataract is clouding of the lens. So basically, the transparent lens started to be clouded, and some opacities started to form inside this lens, making the light entering into the eye decreasing, and consequently, we started to decrease the visual acuity. The lens also has a very important function other than transmitting the light backward. It does for us what is called accommodation. And what is accommodation? Simply, accommodation is the ability to see far and near and intermediate objects at a clear picture. So it basically, this lens, it can actually be more convex or more concave in order to have the ability of this accommodation. Sometimes with older age, we lose this accommodation also as a part of loss of function, and can result that we are unable to see near objects. We have to make it a little bit further, all to have to wear some reading glasses so as we can see. We will discuss this in details as we are discussing the treatment of cataract. So how this clouding of the lens happens? Normally, it's part of an aging process. That's why you see a lot of people as they get aged, they develop cataract, remove the cataract, and they can see better than that. But the name cataract, interestingly, cataract is coming from the Latin word cataracta, which is actually waterfalls. And this name came from the ancient time, ancient Greek, ancient Egyptians, and ancient Indians. They identified this disease, and they called it cataract because they thought that there was a waterfall coming from the brain to the eye, causing this white opacity inside the eye, and that's what it makes it is not clear. That's where the name is coming from. The next episode, we're going to speak about the causes, what causes cataract, how we diagnose cataract, and what are the types of cataract.